And I would like to kick it over to a very fierce advocate, Christina Hauptman.
I actually work on Long Island as an advocate. I work for two of our largest children's agencies. And yes, I am one of those underpaid, like Kim was talking about. I actually work up to 60 hours a week to provide as a single parent. But my dedication right now is having that child in the system. We know we need funding. We know we need reimbursements to keep staff. I watched colleagues leave. I watched our programs de-designate. But on the flip side, I'm also that parent whose child doesn't have access to services. So I've spoken before pre-COVID. I spoke about our redesign and our failure of our children's services and lack of accesses due to funding. I spoke actually last year with Senator Hauptman. We won a town hall, and I realized then he's very receptive, and this is like our go-to guy, But I've been speaking for 2.5 years since my son came home from residential to his home and community-based services, which he still sits on wait lists. I'm connected. I'm here with all of you. I work for great agencies. I have the connections. My son doesn't have the services. I carry this. I'm not going to read it. We're not going to get into it. But this was my son's first suicide note. This was last year while waiting for services that he should have had in the home. This, for me, the reason I carry this, and like I said up in Albany, it's not for me to read, it's not for that. But this isn't a me problem. This isn't a mine and my son problem. This is a we problem, because this is a result of everything around us, and we're not the only ones. Our most recent suicide attempt was just this past September, and he actually hopped out of my car and walked into traffic. When we got to the hospital, by the way, we're diverted because all the psychiatric hospitals were full, their emergency rooms. When we got to the emergency room, regular emergency room ER, my son's words, and I have them here, that he said to the doctor, he said to myself and to the police officers, I don't need to go back inpatient to the hospital again and again. By going in and out of the hospital, it doesn't show me how to deal with these moments when I am at home, when I'm at school or in the community. I just need someone to help me with coping skills and develop techniques to utilize when I'm in these environments, so I don't feel that this is my way out or I won't have another attempt. My son is absolutely right. My son deserves those. He's entitled to them, and they're medically necessary for him. For 2.5 years, my son's paperwork, these are medically necessary. We have Medicaid laws. We have this. He doesn't have the services. So those were his words. He actually asked me to share them. He's actually been home today because he couldn't go to school. But it's hard because I don't know each day that I'm going to wake up and find him breathing. I don't know. Those of us that are parents, I don't know if you guys remember, but for me, when you have that newborn and you check on them like multiple times a night, like, are they breathing? Like, especially the firstborn, you're looking at them, you're watching them. I think we all do that, when that child comes. Well, I'm doing that with my 14-year-old. I get up multiple times. If I don't hear him snoring, if I don't, if I get up to go to the bathroom, I actually go in his room to make sure he's breathing. And I do that daily, nightly, daily. And as much as I speak, and I'm speaking here today, the problem we're going to come back to, he's still waiting. He's waiting. He tells me, Mom, speak today. Let them know we're waiting. Let them know my friends need help. Little does he know, his friends that he speaks of, I see them on the wait list because I also am a provider. Because I think right here, like I said, this is a we problem. This isn't a family problem. This isn't me not getting my child support. This isn't something that's happening in the home. My son is being failed by our system. And if something happens to my son, it's a result of our system. And I just hope that my son survives to see the changes and to receive the services that he needs and is entitled to. Because without them, I don't think he's going to make it.